Sure, that's a wonderful question. Medicine residents are at a formative portion of their medical education career, and it's an opportunity to begin to learn about appropriate usage of antimicrobials. By participating in the antimicrobial stewardship program, they can see what the stewardship committee thinks are important topics that need to be addressed and different innovations and initiatives that are going on in the hospital, and help to communicate that to their co-residents and be active role models in the hospital for those good antimicrobial stewardship practices. I honestly think a lot of hospitals have forgotten about the medical residents or have not really gone and tried to get them involved and just bring them onto the stewardship committees. I know at our hospital I was very active at wanting a position on the stewardship committee, but I'm also a little bit biased in that my training is I'm a pharmacist that then went to medical school. So I have a little bit of that dual background, which makes me want to get involved. But I've since been able to bring on some of my other co-residents who are interested in going into infectious diseases, and they're now playing an integral role in our hospital's antimicrobial stewardship program. So I think it really just comes down to seeking out the residents to become members of the ASP program.
Great. So are there any other stakeholders being left out of stewardship efforts?
Sure, I think we have multiple opportunities. I know at our hospital we've been trying to grow the members of our stewardship committee. Primarily, we've been adding on nursing, which was not there whenever our committee was first formed, trying to get more executive leadership involved, bringing IT to the meetings. And I think one opportunity that I think we very much excluded at our prior meetings that I've gained from a session I went to yesterday was maybe we need to start getting some of the case managers involved, because they can help with some of the discharge planning and start to help tie in some of what we're doing at the hospital level to the outpatient side. Sure, so as I mentioned, I'm our resident chair for antimicrobial stewardship, and we're one of just a few hospitals that actually has a resident chair. So what we wanted to look at was how the resident perspective of antimicrobial stewardship at our hospital differed from two other hospitals within our health system that have an antimicrobial stewardship program but do not have a resident chair. And what we found is that our hospital, 100% of residents were familiar and knew about our program, whereas only 40% of the residents at the other two hospitals even knew that their hospital had an antimicrobial stewardship program. We further looked at survey responses and found that our residents were much more satisfied with interactions and interacted with the stewardship program on a much more frequent basis, many of which residents will interact on a weekly or monthly basis, whereas residents from the other two hospitals without a resident chair were interacting less than monthly, was the most common answer, if they interacted with the stewardship team at all. And all of those residents reported interactions as acceptable or middle of the road, whereas our residents were reporting satisfaction as acceptable, outstanding, and exceeds expectations. So basically the highest levels of satisfaction.